Hi, my name is Kyler Edwards, physical therapy student from Rocky Mountain University, and today I'm going to be talking about thermotherapy. And what I mean by thermotherapy is just heat. So your hot packs, your whirlpools, stuff like that. So when to use thermotherapy versus when not to do it, or your contraindications versus your indications. I like to start with the contraindications because these are what can get you into trouble and possibly sued, if not losing your license. So I like to go through these to know what can get me in trouble. So first, the questions you want to ask your therapist, these are your basic contraindications. So no matter what you're using, whether it's cryotherapy, thermotherapy, ultrasound, you can never go wrong asking any of these questions. So the first one is pregnancy, asking if they're pregnant or are planning on being pregnant. That can cause complications if you use modalities. Active cancer, not a good site if you use modalities on a site that has active cancer. So always ask for that. Lack of sensation, you want them to be able to feel if it's getting too hot or too cold. And if it gets too hot or too cold, they can take it off and you can respond appropriately. Otherwise, if they lack sensation, you could potentially burn them and then you get sued. Poor circulation can also ties in with lack of sensation. And by poor circulation, it just doesn't distribute the heat in this case, and that's when they can get burned yet again. And then you want to be careful of pacemakers. You just want to make sure, especially if you're doing electrical stimulation, such as e-stim, that you're not messing with the pacemaker because that can lead to problems and potentially even death. So these ones are your basic contraindications. You want to ask at least these whenever you're doing any type of modality. Now, specifically for heat, the contraindications, acute injuries is a big one. Okay? If they have an acute injury, forget about it. Don't do it. Don't do heat. All right? You want to use cryotherapy for that one. Okay, if they have impaired circulation, that ties in over here to poor circulation. So once again, if they have bad circulation, don't do it. If they have a vascular disease that prevents, once again, circulation, don't do it. Skin anesthesia, that just means that they can't really feel the skin due to anesthetics. And so you don't want to do it because once again, if they can't feel the heat, they won't notice if they're getting burned, leads to problems. Open wounds, you just don't want anything on open wounds. You want to let them heal, so no open wounds. Active edema, don't want it on that either. There's already so much fluid there, there's already so much blood there. It doesn't need any more fluid. If anything, you need drainage, so you don't do it for active edema. So these are your contraindications specifically for heat. All right, and the last one, the green side, your indications, when to actually use this. So you got subacute and chronic inflammation. Once again, no on acute injuries. So you're going to do subacute and chronic inflammation. Subacute chronic pain would also be an indicator for heat. Decreased range of motion, another indicator for heat. It will help with extensibility of the tissues and help increase range of motion, especially if you do it with stretching or exercise. Promotes healing. By using thermotherapy, you're promoting the healing process, so it will help with healing. So that's when you want to do it, especially if you're trying to promote healing in that area. Trigger points will help loosen up those trigger points, make them more relaxed. So once again, good for trigger points. Muscle spasms, it decreases muscle spasms. So good indication to use it. If you have a subacute muscle strain or a subacute ligament strain, then good to use it. Those will help take care of those injuries. But once again, subacute, not acute. And then main things to remember, last little tidbits, is that heat can potentially go up to 5 centimeters, but you want to be careful. You don't want it on there too long, otherwise you can burn them. And then the last thing is we want to get the tissue temperature to 104 degrees. The minimum to receive any of those effects based on those indications is 104 degrees. And the highest you want to get to is 113 degrees. If you go beyond 113 degrees for those tissues, you could potentially burn the patient. And so now what you're going to see next is a video example of what to do with a patient when putting on thermotherapy or heat. All right, so we have a patient, Jack, today. He had a patellar fracture 6 months ago, and he got his cast off 6 weeks ago. And so now we're going to show how that interaction went when putting heat on him. Hi, Jack. How's it going?
Doing well.
Doing well? Alright, sounds good. So I want to try something new today before we hop right into physical therapy. I want to put some heat on your knee right before we do physical therapy because I want to warm those tissues up and allow for more movement.
Okay.
Are you open to try that?
Yeah, absolutely.
Alright, so first what I'm going to do is I'm going to get a pillow. And so as I'm getting you ready, go ahead and lift your leg up. Perfect. So just a couple questions to ask you before I put this heat on you. Is that do you have any lack of sensation in your knee or around your leg?
No.
Perfect. And then do you have any active cancer that you know of?
No, not that I'm aware of.
Alright, well that's a good thing. That's a real good thing. Alright, so no lack of sensation, no cancer, no poor circulation issues, anything like that. Alright, and then this happened a while ago, so this will be a subacute injury, meaning that he's in the proliferative and early maturation phase, meaning he is good to go for heat. And so, alright, I'm gonna go put this heat on you. So now with this heat, it will get warm, but it shouldn't get hot or feel like it's burning you. If it becomes painful or feels like it's burning you, then it's too hot. Take it off, put it on the floor, whatever you need to do, okay? And so what I'm gonna do is I'm gonna set a timer for 15 minutes, and then when that 15 minutes is up, I'll come and take you off the heat. Once again, if it feels too hot, take it off immediately, don't worry about it. And then if it starts feeling too hot or it's getting a little too warm for your liking, just hit the bell right here, and then I'll come in and take it off you, and then we'll get ready to start physical therapy.
Okay.
All right? I'll be back. All right. How'd that feel?
Felt great.
Felt good? Wasn't too hot, right?
No, it wasn't too hot.
All right, and skin looks good. There's a little redness, but that's just from the heat, allowing for your blood to kind of start moving faster and get ready to go. All right, you feel ready to exercise?
Yeah, I feel ready to go.
All right, let's get you going.